Hi, my name is Elizabeth Maida. This is my case study 2 presentation for class 638. Okay, so to get started, just a review of my client information. He is 5-year-old male with an autism spectrum disorder diagnosis. The main behavior of concern that we're looking at and addressing within this intervention that we're talking about is elopement. Any instance of the learner leaving, moving 5 feet or more from the designated area without permission is going to fall under the elopement definition. So an example is the child gets up from the table and runs to the other side of the room before the designated task was complete. And a non-example is the child is playing with peers and he runs to the other side of the room while he's laughing. So the intervention that we're utilizing is functional communication training, also known as FCT. We use this alongside with a choice board. So this was selected in order to teach an appropriate replacement behavior. Through the assessment, we saw that the function of the behavior was escape as well as access to reinforcers. So for escape, we're addressing this by giving the client the words and the opportunity to request for a break or just say all done. And for access to reinforcers, the client can now ask to use the swing by saying swing or trampoline. He can ask for any of the reinforcers he wants instead of having to run away without saying anything, trying to get access to these things. So the operant extinction that we're looking at is prior to the intervention, the client was able to just escape tasks by elopement. He was able to gain access to all the things he wanted through elopement, so it was working for him. So with the intervention, the therapist used prompting to get the client to utilize FCT statements such as all done or swing. And if the client was not making those statements, not utilizing his choice board, then the therapist was ignoring and trying to block attempts of elopement behavior. So with the ignoring, the therapist would gesture towards the client what they needed to do, gesture towards the choice board. They would also limit their eye gaze, so kind of look the opposite direction while still checking out the client and the peripheral view, as well as limit talking. We did notice, and I'll go into this later, that some of the behavior was also fueled by attention. So, with the assessment, we learned through ABC data as well as an interview with one of his main therapists that many of the instances of elopement were not actually found to be socially mediated. However, there were some occasions where the client was also seeking attention through the function. So this was what I was talking about previously. We noticed that the client would run away, but as he was doing it, he would look back, he kind of had a smile on his face. He was looking to see the reaction of the therapist. So when we went to the intervention section and we were talking about the extinction, that's why the therapist is not giving him that social mediated attention while they're eloping, because they're also seeking that. So instead, they're just looking the other way, gesturing, still following through, not completely ignoring, but at the same time not giving them too much attention. So the DRA process that we're talking about is when the client participates in non-preferred tasks, then they're getting verbal praise. They could be sitting at the table for lunch for 5 seconds. We're going to reinforce that. Great job sitting at the table. I love to see you eating with your friends. Just let them know that they're doing a good job. We're happy that they're not eloping, and even though we know this isn't their favorite thing to do, it's nice that they're participating, and we're going to reward that with that verbal praise. The client also is able to appropriately request to take a break using the choice board and a verbal statement, then that request is going to be honored. So if they're at the table, they say all done, great, go ahead. Thanks for telling me. Nice job, dude. When the client requests for an item activity with the appropriate man, we either vocalizing or using the choice board or both, then we're gonna deliver that verbal praise. Awesome job telling me, nice work, and they're gonna get access to the item, which is gonna be the biggest motivator for them in those instances. Stimulus control. Stimulus control is when a learned behavior is emitted in the presence of certain stimuli and not emitted when the stimuli is missing. So the choice board has been a very effective stimulus control. We've noticed that, especially when they're in the midst of engaging in those problem behaviors, if we can just present the choice board, they're so likely to pick something, tell us something, utilize it to communicate. Even in instances where maybe they're too overwhelmed to vocalize, even just pointing is going to take less effort for them, but be just as effective for us in knowing what they need and all coming to a good conclusion together and figuring it out. So the choice board has been great. We use that as well as when we see precursing behaviors. So maybe we see them looking at the thing, it looks like they're trying to get up, you can tell they're uncomfortable. Pull that out, just let them know, hey, if you need anything, if you want to go, you can always tell me. So that's been really effective to allow them to communicate, to go, allow them to ask for things, use their words, demand, and get access to what they need without eloping and without engaging in the other problem behaviors that we were noticing, such as crying, flopping to the floor. This has really helped reduce those behaviors as well. Thank you.